Dr. Ebo Turkson, who's here representing Dr. Peter Quarty, is going to be telling us all about that. You're welcome and thank you very much. Let's hear you.
So my first part is going to be on the macro impact, and then the second part will be on the micro. Now, the main impact on the Ghanaian economy, one comes from the macro indicators. Ghana has done so well over the last 4 years in terms of trying to achieve some stability. We are projecting that by 2030 we should start looking beyond it. So we've gone through some reforms lately. But when the COVID hit Ghana in March, and we had already projected that 2020 we were going to do so well and continue where it had come from. Obviously, it was going to have an impact on the efforts that we've made over the years. And the main reason being that the government responded to contain the pandemic. And part of the response was to close schools, ban certain social activities that had economic implications. Some sectors were affected, jobs were lost, and therefore our growth targets were not going to be met. We had expected to grow at 6.8% in 2020. It was revised to 0.9. Not only that, even in terms of the impact on the hospitality industry, for instance, and then tourism, the closure of our borders, and especially international travel, meant that we are going to be hard hit in terms of the tourism sector. Don't forget that over the last years, we've had service sector driving our growth, which meant that our economy was not going to grow. Now, the impact that it had on the macro indicators were from two fronts. And I'm going to say this because over the last couple of weeks or so, there has been a debate on our national debt and whether it's moving to levels that are unsustainable. But I've said over time that this is not a time to talk about whether our debt is sustainable or not. Because once the pandemic hit and government revenues declined, at the same time, because of the negative impact of the COVID on jobs and other sectors, the government had to also come in to try to at least cushion some severely affected sectors, households and individuals. So whilst government revenue was declining because of the decline in economic activity, the government had to spend more also to try to support. So it was going to widen government's program deficit, no doubt about it. And so every economy of this world is having to see higher levels of debt. I mean, the United States. And so the issue of whether our debt is high now is not something that we should even discuss. We should look at how we are going to be able to contain the pandemic and find out how our economy is going to recover as soon as possible post the pandemic. And so at the macro level, that is what we know. And the Minister of Finance has spoken much about it. And so I don't want to belabor the point back.
Right, but much as you talk about the fact that we shouldn't worry about we shouldn't be discussing the debt level, we should also be mindful so that we don't use COVID as an excuse to let the debt also balloon. Don't you agree?
I'm not saying that we shouldn't discuss it. I'm saying that we should look at where we were at the end of 2019, what we are projecting to be at the end of 2020 before COVID, and then do an assessment of the impact of COVID on our debt situation. Because if you look at the amount of resources that was needed to be able to contain the pandemic, don't forget that there was the need to produce a lot of PPEs. The government was giving incentives to frontline workers. At the same time, we had electricity, water. These are all expenditure items that were totally unplanned for. And therefore, with economic activities declining and our revenues declining, there was going to be a shortfall. So if we need to do a content analysis of our budget, let's look at the part of our debt that has increased because of containing the pandemic. And then what is left, we can do a content analysis of it to find out how we got here. But to begin to discuss, oh, it's over 70%, no country in this world is discussing its debt to GDP ratio now. because these are not normal times. And these pandemics do not just happen just like that. It takes a long time for it to happen, but when they do, most countries are caught unaware because we never thought this was going to happen. So that's the point that I'm making, that yes, it has had an impact on our debt to GDP ratio. But what is most important is to ask the relevant question, are we able to support those who have been hard hit by the pandemic? And to what extent are we providing them the support to at least make some decent living in these times? Because don't forget that your health is also important for you to be able to withstand the possible infection. You should be well fed and all of that. And it is, so every government in this world is looking at the aspect of support for those who are poor, especially the vulnerable and the poor. And that is why the National Corporate Secretariat contacted Professor Cote, and then he asked that, let's go to the poorest district of this country. We identified 80 of them, and do a random walk and interview households and assess the effect of the pandemic on their socio-economic, what do you call it, activities. Now, we went to all the 80 districts. We interviewed close to 11,000 households, made up of over 44,000 individuals. And we found some indicators that we thought that the COVID Secretariat had to know that this is what is happening. Because even in Greater Accra, you'll be surprised that one of the poorest communities in Greater Accra had it by the COVID than other, even rural areas that we thought were poor. And so in choosing these communities for us to do a sweep and find out, we have to be very systematic in our choice, to make it very scientific, so that if the National COVID Secretariat goes out there to support, the support will have the needed impact that would help these households to get out of the pandemic. Can you go on? I've spoken about that. Get to the part of the survey. I need to show some. Go on. Yes. So this is what we did. It was a three-stage process. We chose the 80 districts. Then we chose 2 communities in each of the 80 districts that were very poor. We did this with the district assembly, of course, using other sampling frames. And then we made a clean sweep of those communities by going to every household in the community to interview them. Next. Now, so this is a breakdown of the 16 administrative regions and the number of households that we surveyed. And when you saw the report that her leadership put out there, over 10,400 households were supported. And then next. So the first thing that we saw was that most Ghanaians were aware of the COVID. I mean, in fact, almost 98.5% of Ghanaians were aware. Even in those poor communities, they knew something had come, and they had to be careful. Next.
They probably couldn't pronounce the name, but
yes. Even the least communities that didn't know, about 93% of them knew about the COVID. But what was most important for us was whether they had lost their jobs because of that, because that is at the center of livelihoods. And if they are no longer working, themselves and their families. And we found out that about 55%, almost 56% of them have lost their jobs. And it was much more higher in some regions, or those poor communities in those regions, than others. Right? We also found out, of course, the worst hit region was the northeast region, and we suspect that because of the closure of the border up north, there's a lot of economic activities that goes on across the border, so it did have an impact on them. Maybe for tourism, because there have been a closure of tourist activities, it also affected them. Then also we took a look at the stigmatization. The point was that we wanted to find out from them if they knew somebody had recovered from COVID, and the person is selling any item, they will go and buy it. They said no. And in fact, for us, it was a concern because we had to go beyond the stigmatization. And almost a third of them said they were not going to deal with anybody who they knew had COVID and had COVID. And this survey was done somewhere around July. I mean, then also of course, the stigmatization was highest in the northern part of which we think that because of the fact that possibly a depth of literacy that is very low in those areas than other parts of the country, and it was highest in those regions. Surprisingly, the Volta region also had a relatively higher level of stigmatization. Then, what was most important for us was the impact of the COVID on income and expenditure. Now, the most hit sectors that are seen, regions that have seen a reduction in their income were the Ahafo, Greater Accra, Central, Northeast, and Ashanti regions compared to the others. And then those that had, so this is what we did, we asked them for their income. Now, normally when you go into households to do that kind of survey, they are more comfortable talking about their expenditure than their income, especially when they are not too sure what they are going to use the results for. They might think that for tax purposes, you want to know how much they earn. So we went with the two approach that let's talk about their income, also talk about their expenditure. So apart from asking them questions about their income, which we knew that even if they believe what we are doing, they might think that we are coming to ask them these questions for us to come and support them. So we expected there was going to be some biases. If you ask them, so what has been the impact of the COVID on your income? We're expecting some of them to give us figures that were way above what had actually happened. So apart from income, we also asked them about the expenditure. And then we also found out that most of these regions that had the highest decline in their incomes were those that are also saying that it had an impact on the expenditure. So it confirmed what we found. And then in terms of the impact of the household that had the most, were worse off in terms of before the COVID and when the COVID hit, their household situation, they considered to be worse off. We found out that the Greater Accra for Northeast. So the same regions that we had identified, which meant that if there was going to be any support with very limited resources, these were the 5 regions where they had to go to support them because there had been a sharp decline in their income, the expenditures had declined, and they were worse off than before the pandemic. So the key points were 3. 1, the pandemic had hit, Ghanaians were all hit. The very poor had been hit by the pandemic. There was some stigmatization that was going on in some of the regions. There had been a decline in income because jobs have been lost. Over close to 50% of the population that we sampled had lost their jobs. Then also the idea that the expenditures have also declined. So on the basis of that, we made recommendations to the COVID Secretariat that there was a need to make lump sum payments because we estimated that if the COVID was going to stay long, the extent to which households could get immediate support and on the basis of how much resources were available, we are expecting that at least if they get support for 3 months. We are hoping that beyond 3 months, as at the time we did the survey, economic activities are resumed for them to go back to their jobs. So we recommended a lump sum payment to the Secretariat. And we focused on the very poor. Because when you go into some of these poor communities, there are some households that are okay. So we are recommending the very poor based on their expenditure levels to make payments to households that had at most 4 members, and then increase whatever payment we're going to make by 20% for those that had more than 5, because they tend to have a larger size. And then also for us to increase the sensitization against the stigmatization of those who had gotten COVID and recovered. So that was our recommendations to the Secretariat. Now, so as we speak now, the economic impact has not been as bad as was expected, even from the media review of the budget, because hopefully we would grow beyond the 0.9 that was projected. Inflation might not hit the 11% that was projected, maybe slightly below that. And other indicators have not been as bad as was expected. But what's important to note is that there are some sectors that have also increased their growth rate because of the pandemic. So any effort to recover our economy as soon as possible will be to concentrate on those sectors: ICT, education. These are sectors, health, especially production of PPEs. And these are sectors that have shown that in the face of this pandemic, they are still growing because of the sort of economic activities that are involved there. Also, what is important for us, agriculture is going to grow. We're expecting about 5.7, but we're expecting about 3.7. Unfortunately, services is going to recede. The growth rates are going to be negative for services. But even then, we are expecting that by the end of this year, if the way the economic activity has started recovering, and we don't have a second wave that is going to be as severe as the first, and there's not going to be any lockdown, then even the service sector should see a very low growth, but not a recession. So that is the socio-economic impact that we were able to.
Thank you. Yes.